I wanted to be careful about this next question, but I feel I have to ask it. I have my own personal views on it, but I would love to know what you think, which is there a connection between hyperacusis and mental illness?
As I just said, with the risk factors, there's definitely something in there with depression and anxiety, and even post-traumatic stress syndrome is associated with mental health. The problem, it's probably very similar to tinnitus in the sense of, again, it's this chicken and egg situation, is we'd never know whether it was an anxiety that kind of could have been one of the potential kind of reasons that the sensitivities started happening. If you think about it from a kind of very logical point of view, when you're anxious, your whole body is very kind of tense, and you can feel shaky, and you feel quite sensitive. Your skin can feel quite sensitive. So it's quite a logical move that your hearing could become sensitive in that moment. You could feel very sensitive to sounds, and even visually, when you're anxious, your visual intake can be much worse, and you can feel that you're not taking everything in. I will say that there's definitely one of the kind of problems that's associated with having hyperacusis is mental health problems, in the sense of people that have hyperacusis report problems with anxiety and fear and depression, problems with sleep. So there is something going on. It's just quite a lot of, again, logically, if you've got hyperacusis and you're living with that every day, then there's going to be anxieties about leaving the house. There's going to be fear about what it all means. And, if you're slowly isolating yourself from people, then that could definitely lead to mental health issues with depression. And, that's what we've seen from this COVID pandemic. If anything, if you see, the mental health of the nation has gone up because we've been removed from interacting with people, and you don't realize how important that is till you've taken it away from you. So yeah, long answer, but there's something there. I just wouldn't say which way it would go. I couldn't say.
No, thank you very much. That was very sensitively answered. Thank you, Kathryn.